There's only one tip for managing abscess, and that's drainage. So if an abscess is ready to be drained, no amount of antibiotics is going to fix this problem. So it's important to do a cruciate incision so that you get an adequate hole for the pus to discharge from. If it's an infected sebaceous cyst, for example, then even though the initial infection will settle, if the underlying problem is still there, such as the lining of the cyst, they can get a recurrence. So the most important thing is drainage. You may use antibiotics if they're diabetic or if there is surrounding cellulitis or lymphangitis, but in the majority of times, drainage is sufficient. You can't prevent an abscess from occurring. If an abscess wants to occur, such as an infected hair follicle or infected sebaceous cyst, it's nearly always due to the flora on the skin, and there's nothing that you can do to prevent it. All the amount of antibiotics in the world is not going to prevent an abscess from occurring. Abscesses are very, very common. They do not need to be seen by a surgeon. Sebaceous cysts, very, very common. They do not need to be seen by a general surgeon or a plastic surgeon. Small lesions such as SCCs or BCCs that are clinically obviously diagnosed do not need to be seen by a specialist. They need to be competently excised with an adequate margin and sent for pathology. But they're the commonest ones, and the last one, of course, is a lipoma, because they are very, very simple to remove. Probably the commonest lump that is seen in general practice and in specialist surgical practice, like mine, is a sebaceous cyst. And sebaceous cysts may vary from being 2 to 3 millimeters or maybe 5 to 6 centimeters, so they can be really quite large. The decision to be made is, do I need to remove this cyst? If they have a small cyst on the back, then it's quite safe to leave it. If the cyst is on the face or on the neck or on an area that's exposed, such as the upper chest, then it may be worthwhile removing it. Once you've decided to remove the cyst, it can be safely done in a general practice under local anaesthetic, but the most important thing is that you remove the entire cyst. If you get into the cyst and it discharges and you don't remove the entire cyst, it can recur again in 3 months or 6 months or 12 months' time. Not all cysts have to be removed. Some people have sebaceous cysts on the earlobes, which may be related to earrings. Some people have sebaceous cysts on the head and neck area, and that's a very common area. They don't need to be removed unless they're cosmetically unacceptable or if the patient requests it. So we often do things on patient's request rather than medical need.